Welcome to the Prescription for Success podcast with your host, Dr. Randy Cook.
Hello, everyone, and welcome to Prescription for Success. I'm Dr. Randy Cook, your host for the program, which is produced with support from MD Coaches, a company dedicated to developing and empowering physicians to realize a greater potential and to achieve a greater level of satisfaction in their chosen fields. You can find MD Coaches on the web at mymdcoaches.com. On today's program, we'll be hearing my interview with Dr. Stephen Reich, who is a fellowship-trained orthopedic spine surgeon, community leader, venture capitalist, and philanthropist. Dr. Reich attended medical school at the Albert Einstein College of Medicine and completed his orthopedic residency at NYU Langone Hospital for Joint Diseases in New York City. He then completed a fellowship in spine surgery at the Thomas Jefferson University Hospital in Philadelphia. Currently, Dr. Reich serves as clinical assistant professor of orthopedic surgery at Rutgers Robert Wood Johnson University Medical School. He is a member of the North American Spine Society, the American Academy of Orthopedic Surgeons, and he has served as president of the New Jersey Spine Society. Additionally, he was appointed as the former chairman of the New Jersey Commission on Spinal Cord Research, and in that role he testified before the United States Congress. He has been published in a variety of peer-reviewed journals. He is a passionate educator of medical students and residents. Dr. Reich and his wife, Jodi, are the founders of the Humanologi Foundation, which is a nonprofit organization aiming to refocus attention on the roles of empathy, humanism, and compassion in healthcare. So now let's hear my interview with Dr. Stephen Reich. Well, Dr. Stephen Reich, I'd like to begin by saying welcome to Prescription for Success, and thank you so much for taking the time to be with us today.
My pleasure. Thank you for having me.
And I'm very much looking forward to hearing all about your story, which is very interesting. Obviously, I've done a little bit of research on you, but there's a lot of things that I'd like to hear about in your own words. And let's just begin by sort of going through the steps that you had to go through to get where you are. My understanding is that you did your undergraduate studies in engineering at Boston University. Is that right?
That's correct. I was a biomedical engineer.
An honors graduate. And were you thinking medical school at that time, or were you thinking more in terms of actually a career in engineering?
You know, it's interesting. Since I was a young child, I always wanted to be a doctor. At that time, in high school, I said, you know what, maybe I'll apply for a 6-year medical program. There was no counseling. There was no guidance. I took a test. I didn't get into the 6-year medical program at Boston University, where I'd applied in one of the other institutions.
So just to make sure that we understand, I'm familiar with some of these programs. They were not as widely available when I was beginning my medical education, but this is actually a program that begins at the freshman college level with the intent of integrating your undergraduate studies with your medical education. Is that correct?
Yeah, it was basically, it took the 4 years of college and 4 years of medical school and would accept you as a high school senior, and you would save, if you consider it saving, that 2-year period. And that was the goal of the 6-year medical program.
Right.
So when I did not get selected for that program, Boston University indicated that they had a program in biomedical engineering. And I really didn't know what that was. Matter of fact, when I originally heard, I got something from the College of Engineering, I thought to myself, I wasn't interested in operating a train. I wanted to be a doctor.
Right.
And at that time, my parents said that if you get a degree in biology, what will you do with yourself if you don't get into medicine? Maybe you should find something different to do. And I sort of poo-pooed that advice. And then when this came along, it sounded fascinating. And that's how I got introduced to biomedical engineering. And it was a fascinating study, fascinating education, and really taught me tremendous amounts about how to think from a critical, analytical, scientific standpoint. And I use that education virtually every day.
I found that very interesting. I think you are the first individual that I've ever known that had an undergraduate degree in engineering prior to going to medical school, and that is a fascinating story. And do you think you had an eye toward orthopedics even at that point, or was that something that evolved later?
Oh, that was much later. It was interesting. In college, I had worked on the design of a retinal scanner with people from Harvard and MIT and Mass General. And I was very excited about possibly going into a field of ophthalmology at that time. That's the work that I had done. And only later when I was in medical school did I realize that that would not be a successful course for me.
I see. And tell me a little bit more about what medical school was like for you. Can you think of individuals that might have stood out as a particular mentor or influencer in your life? What was that like?
Well, I had the pleasure of going to Albert Einstein College of Medicine in the Bronx, and I had a fantastic time in medical school. It was actually quite enjoyable. I often tell people that engineering, you could know all of the material and come to an exam and get a 0 if you couldn't apply it. And medical school was a bit more of memorization and recall. And that was certainly, at least after finishing my undergraduate degree, relatively easy. So I really had a wonderful time in medical school. I had many mentors throughout my medical school education. One of them was a surgeon by the name of Ralph Gare, and who had unfortunately passed away. And he was a general surgeon and an amazing artist. And he would go up to the front of the class, completely knew the anatomy, and would lead a delightful class full of stories and how the anatomy really came to life. And I had always been interested, I had thought, in a surgical specialty, and I was just enamored with his ability to communicate and to really walk up to the board and draw the equivalent of a Frank Netter picture in perfect detail. And he was fascinating. We had been blessed with many physicians and educators who were excellent. And I had a particularly close relationship with the dean of the medical school, Dominic Purpura, who had recently passed away, who was also inspiring. And I felt that entire experience was geared towards my professional development, and that it was a wide open palette, and there was no need to pigeonhole myself into anything, and to just learn and be proactive and meet other people, and just to get a very wide educational experience, which I really loved, and to this day I'm very appreciative of.
Sounds like you really enjoyed medical school. I know I personally consider those years probably the best years of my life. You're participating in the healing arts, and yet you've got people all around who can make sure that you get through it all right. It's a wonder. For me, it was really a great part of my life. Would you say it was the same for you?
Yeah, absolutely. I very much loved the years of the training and the knowledge and the application. And I enjoyed it so much, I had a very hard time trying to figure out what field to ultimately go in. I had mentioned that I had done this research in ophthalmology and had met with a number of the residency and fellowship directors through this research. And I was quite sure that I would have a career in ophthalmology. And I remember when I went on my rotation, the first day in ophthalmology, I went to the clinic and I fell asleep in the room. So my wife, she was my girlfriend at the time, she said, "How was your first day of ophthalmology?" I said, "Oh my God, it was terrible. I fell asleep. It was the worst." So she said, "Look, you were probably too excited from the night before. I want you to go to bed early tonight, have an early dinner, don't stay up late, get up nice and early, get yourself all in the right mindset. This is your whole future." And I said, "Great. Thanks for the advice." I went to the ophthalmology clinic the second day, and I called her at the end of the day, and I said, "I don't think I'll be able to finish the 2-week rotation. I hated every second." And I was devastated. I was really upset. And I remember going to play at Einstein, they had a pool room. So, there was a pool table. So I picked up, I was terrible at it anyway, but it looked like something to do to maybe clear my thoughts. So I pick up the pool cue and I'm hitting the balls, whatever, a little bit, terribly, of course. And this guy looks at me and goes, "Man, what's up with you? You look terrible. Why are you so upset?" I said, "Oh my God." I told him the whole story. I thought I was going to be an ophthalmologist. I couldn't finish the second day. It was terrible. And he said, he goes, "No, you're not going to be an ophthalmologist. You're going to be an orthopedic surgeon." I said, "Well, what do they do?" He said, "It doesn't matter. That's what you're going to be." And he was right. And he said, "That's a personality kind of issue." And that's exactly what happened.
So are you saying you hadn't really considered orthopedics up until that moment when you suddenly discovered that ophthalmology was not for you, and it was not necessarily the first thing that popped in your head? Somebody just happened to be in the right place at the right time. Is that it?
That's exactly correct. And the right place at the right time, I've seen that theme many times through my training and my practice. If you're religious, you think it's from above, which is my personal thought. But I've been very fortunate and blessed at so many times to have had the guiding hand direct me in the right way. And I can't even tell you who it was who told me that, but that one moment really changed the course of my life.
That's a great story. And I appreciate you sharing that with us. We finally are at the point where you have a decision. You finish medical school at Einstein, and you also went on to do your initial orthopedic training in New York. Is that right?
Yeah. So I applied for orthopedics since I finally found out what it was about. I was privileged to be accepted and have been trained at Hospital for Joint Diseases Orthopedic Institute, part of NYU, and had a phenomenal residency program. I was fascinated with virtually all areas of orthopedics. And I had a similar kind of event. I was in my 4th year of training as an orthopedist. And it came time where I was trying to decide what type of fellowship I would do. What ended up happening was I really enjoyed sports medicine and I really liked spinal surgery. And I couldn't decide which one to do my fellowship in. And now my wife, we were married, and my poor wife was trying to deal with her unconsolable husband who couldn't decide what he wanted to do with his life. And I remember trying to figure this out. And no matter what happened, I couldn't come up with an answer. I said I felt pretty good about sports medicine. I enjoyed it. But I was really nervous about spine surgery being so high risk and the lack of, do-overs, in the spine. If something doesn't go well, that can often be irreversible and catastrophic. And that type of life event is less common in a sports medicine type of practice. So I was concerned that I wasn't good enough at it and I didn't know what to do. And I remember being very upset in having difficulty in terms of trying to figure that out. So it reminded me of the night in the pool room in medical school. And I was talking to one of my dear colleagues, or actually one of my mentors, and his name is Dr. Jerry Lubliner. And he's a wonderful sports medicine physician, a mentor, an unbelievable guy. And I told him my debate. I said, look, I don't know what to do. I love sports medicine and I think I love spine surgery, but I'm afraid I'm not good enough at it. And he gave me two outstanding pieces of advice, which I have repeated millions of times. The first piece of advice he gave me is, no, don't worry, you're not good at it. He goes, here's the way it works. You're good at what you like and you like what you're good at. So if you're not good at something, just say you like it and you will ultimately become good. You should know that motto has lasted through my entire lifetime with my children. And they go, I don't like math. I'm not good at it. I go, that's the mistake right there. You have to say you love it. Once you say you love it, then you will become very good at it. My oldest daughter went to Columbia. My middle daughter graduated from Barnard. She's going to Harvard for an MBA. And my youngest daughter is starting Barnard in 2 weeks. So I can only tell you that advice of be good at what you like and like what you're good at, it's a self-fulfilling prophecy, and it worked well for them. But more directly, Jerry Lubliner, I came to him and said, I'm really concerned. I don't know what to do with myself if I should be a spine surgeon or a sports medicine surgeon. And the advice he gave me was as follows. He says, I want you to take every spine surgeon you know in your mind and put them in a room. He goes, I want you to take every sports medicine surgeon you know and put them in a room. And in each person's hand, I want you to put a drink. And I want you to put a drink in your hand. And I want you to go from room to room, back and forth. Which room would you rather be in? And I thought about it. And I said, I think I'd rather be with the spine surgeons. He goes, great. Final decision. You're going to be a spine surgeon. And that is the honest truth of how I decided to become a spine surgeon.
I think that story and your previous one are the most fascinating stories that I have ever heard about making decisions for your career. You found some really good people, either purposely or by happenstance, to give you some good advice, and you followed up on it. That's really great.
I was just recently talking to a medical student who was concerned in their third year about which rotation to do first and second and how that will ultimately affect their ultimate career. And I remember my poor girlfriend at the time, my poor wife, I said, oh my God, I want to be a surgeon. So I have to start with medicine. If I get surgery first, that'll be terrible. So I have to do it later because I won't be good. And then I have to do OB here. And then I got to fit in my ophthalmology. And then I got to do this. And I remember, there was no spreadsheets at the time. So we took large pieces of paper and I drew out graphs and charts and calendars for the final 2 years of medical school. I must have spent hundreds of hours analyzing, debating, which was better. If I don't get this one, this will be a catastrophe. My life will be ruined. I spent so much time, my poor wife had to listen to me and go over all of this nonsense. And I can look back at that now and say that was a completely useless, futile waste of time. It made no difference whatsoever. And nothing really gives you knowledge like perspective. And I think, Randy, in our discussions before, that perspective over a lifetime and in a career, there is so much that you see, or for me, that I see now, and I know from our discussion of what you see as well, that when you look back and say, wow, I was really focused on the wrong thing. I missed what was important. It looked important at the time, and I guess it was like my nose was so up against the tree, I couldn't see the whole forest. And I guess that at this point, One of the advantages is for you and I to be able to look back with the retrospectoscope and to be able to look at that 30,000 view of the forest and to be able to say, what was important, what's not important, what do you wish you could have done over? And although I've had tremendous successes, I've had tremendous difficulties as well. And I'm fortunate and thrilled to be able to talk about all of that with you today.
That's a great perspective. And I think it rather underscores the reality that, you have an opportunity to transform those difficulties into something that's really meaningful if you just sort of stay on the task, I think is what you're saying. There's still much more ahead in terms of the learning. The next stage will be your spine fellowship. So tell us a little bit about how you made that decision and what the fellowship year was like.
Spine fellowship was a fascinating process. I remember applying to numerous programs throughout the country, and my poor wife, Jodi, was excited because I was going to San Diego and Florida and California and all these beautiful places. And she was excited to spend that year. And I went to my interview at Thomas Jefferson University Hospital and Pennsylvania Hospital in Philadelphia, and it was a combined orthopedic and neurosurgical spine fellowship. I got to train with Fred Simeone, neurosurgeon, really the father of spine surgery, and I got to train with Jerome Kotler of blessed memory, and Rich Balderston. And I remember that was when I called my wife after the interview. She said, I know we have all these lovely places to go, and I know you're going to pick Philadelphia. I said, you're right. So she wasn't so happy with the location.
So Jefferson was your first interview?
No, I had a number of interviews, but that was clearly my first choice. I was privileged to be able to do a combined orthopedic and neurosurgical spine fellowship, and that's one of the spinal cord injury centers. We had a tremendous amount of spinal cord trauma, tumor, degenerative, deformity. It was an outstanding fellowship and probably the best year of my training, and made lifelong friends, mentors, and was really blessed to have been able to train there.
And the duration of the fellowship was how long?
That was a year.
And then at that point, you were ready to take on private practice. I wonder if that was your ultimate goal, or did you ever entertain the idea of staying in academics? What was happening in your head at that point?
It was interesting. Part of me very much wanted to be in an academic practice. Part of me was toying with the idea of a private practice. And I remember at the time, there was a opening with a group in New Brunswick, New Jersey, called Brunswick Orthopedics Associates. And the senior partner of that group was a fellow by the name of Bernie Reinberg, who unfortunately passed away, but he was the president of the American Academy of Orthopedic Surgeons. And I remember looking at that job. It was at a medical school. It was an academic program, but the management of the practice was a private practice. And it sounded like a fascinating combination of being able to have independence and say, and at the same time to be extremely involved in education and training, and being at a level 1 trauma center. And as the first fellowship trained spine surgeon at the level 1 trauma center at Robert Wood Johnson in New Brunswick, New Jersey, I felt that was an ideal opportunity. And I remember meeting Bernie Reinberg and hearing all of the masters of orthopedic surgery calling in and saying this was the equivalent of being in Hollywood. That was my impression at the time. And that's how I ultimately came to my practice in New Jersey. And that's 37 years ago, 27 years ago. Change that. I'm getting too old. 27 years ago.
And that actually came with an appointment as a clinical faculty member. Is that correct?
Yeah, that's correct. That was after a period of time and board certification and teaching. And I've held my clinical appointment ever since I've been here.
And would you say that the opportunity to be a teacher, to be a mentor, has made you better at what you do?
It's certainly dramatically improved my knowledge, my skill set. I've been blessed to have been involved with our residents over the many years that I've been at the institution. And that was everything from didactic to anatomy, to lectures on pathology, to preoperative education, intraoperative management, postoperative management, pre and post-surgical management in the office. And I've been very fortunate to have many students shadow me, and whether it's to see patients, to come to the operating room, post-operative management, education, research, publishing. And it's been a fascinating opportunity to give back and to try and pay it forward to the next generation of physicians.
So as you were beginning to establish yourself in private practice, obviously your world gets substantially larger, and you begin to take on responsibilities, I would imagine, with respect to committees and board memberships and things of that nature. What was that like for you?
It was wonderful. So I had the ability to be in a private practice, but the vast majority of my time was at the hospital. So being the first fellowship-trained spine surgeon at a trauma center, I got placed on the trauma committee. I was on the quality improvement and qualitative analysis for spine. Then I got involved in the residency education, further quality improvements. And then I ultimately became interested in the medical society. I initially started out as the secretary and ultimately became the president of the Middlesex County Medical Society. Several years later, I founded and was the founding president of the New Jersey Spine Society. Through my work, I ultimately was appointed by the governor and became the chairman of the New Jersey Commission on Spinal Cord Injury Research.
So you were not only practicing surgery and doing it very successfully, but this was, as I understand it, sort of the beginning of your influence on how healthcare is delivered. Would you agree?
Yeah, I would say that when I was originally asked by my friend, Dr. Linda Corman, who was in the medical society, she said, I really want you to come on the board. You're a very direct guy. You're passionate. And I think you would be helpful in terms of directing a path forward. And what started out as some small involvement ultimately became a fairly substantial involvement. I've met with numerous legislators. I was actually able to get a law introduced and passed in our state and became very involved after serving on the New Jersey Commission of Spinal Cord Injury Research. I was asked to serve on task forces from the New Jersey Department of Banking and Insurance, Department of Health, in a variety of areas, and felt it was my...
Well, before you, and I apologize for interrupting, but before you go much further, I would like to hear a little bit about this law that you supported and I gather was ultimately passed. This is very interesting.
Yeah, so at the time, this had to do, it was actually called S-17, and it was put into law by a unbelievable friend and mentor, Senator Jackson Agra, who unfortunately passed away. And it was interesting. It comes back to the very beginning of my practice, where my partner was the president of the American Academy of Orthopedic Surgeons, and he was very good friends with the president of the hospital at the time, whose name was Harvey Holtzberg, who unfortunately passed away, who was a true mentor, a true friend, a true visionary. And I really felt that he was 100% my partner in every initiative. And I remember at the time, a group of the people from the Medical Society went to meet with Senator Sinagra, and he was very frank, and he was an amazing, amazing legislator. And I remember him asking us at our meeting, do you want to know why nobody cares about anything you guys care about? I said, what? He goes, do you want to know why when doctors come and complain, nothing happens? Do you want to know? So we all said yes. So he said, well, let me explain it. You're cheap. You guys are not involved in politics. You do not contribute to political campaigns. So I was devastated, speechless in the room. He said, do you know what the average attorney gives to political action on a yearly basis? All of us shaking our heads. He goes, $10,000. He goes, do you know what the average chiropractor or optometrist gives to political action money on a yearly basis? We're all sitting there totally, devastated. Like, I can't believe this is what we're talking about. He said $1,000. He goes, you know what the average doctor gives for political action? $10. That's why nobody cares about anything you say. And first I thought to myself, oh my God, this is terrible. That's not how politics is. You vote for the right person. What was my experience? I was a kid in public school, and, the person ran for student president. And if one kid came in with Hershey bars, the principal and teachers would have stopped that immediately. They would have said, you can't do that. You can't have any favors. You have to run on what happens. And I ultimately learned a little bit the hard way. And I really thank Senator Sinagra. There's a Senator, Jack Lynch, who I recently spoke with, a tremendous educator, and explained to me what I was so confused about and how the rules are made and who's making the rules, certainly in regards to the laws of healthcare. And the answer was there was no doctor involved in that. And through my involvement with these other areas, there was a problem that was concerning. So turns out that Senator Sinagra was running for re-election, and I knew his campaign chair. And what I did, I said, I want to know the most you can contribute to an election cycle. And I don't remember the number, but they gave me the number. And I called a number of my colleagues who were involved in the Medical Society. And I said, here's what we are going to do. We're obviously doing something wrong. So I want to check in that number, whatever it was, not a penny less, but that's the number that I want. And we are going to go to this meeting. And I remember showing up at the meeting and brought quite a few people with me. And I remember Senator Sinagra, who was a dear, unbelievable legislator, honest, compassionate, caring, wanted to do the right thing. And we were at a restaurant in New Brunswick called Panico's, and there was a private back room. And he comes over to me and says, we're going to be having a private meeting after this get-together. I'd like you to stay and join us. And that's exactly what happened. And I stayed, I joined them. A number of people got involved. We were talking about some of the concerns at the time when there was an in-network and out-of-network issue. not tremendously dissimilar from today, although out-of-network is quickly dying, I guess would be the word. And what had happened, this particular bill, which you had asked about, was the fact that the insurance companies at the time, if the doctor was in network, they would pay the doctor's bill with the copay deductible. And if they were out of network, they would pay their copay and deductible, and the patient would have the responsibility to see the physician of their choice. But what the insurance companies were doing at the time was they would take the hospital and say, wait a second, it's not just the doctor's out of network, now the hospital's out of network. So they would burden the patient unfairly with the entire hospital cost. So I went to Senator Sinagra, and he said, well, that's not fair. That sounds like a financial leverage to preclude people from utilizing their out-of-network benefits. I said, you're right. He wrote S-17. It went through the Senate, it went through the Assembly, and it was signed into law that it would be illegal for an insurance company who has an arrangement with the hospital to differ the hospital's payment, let me rephrase that. It would be illegal for the insurance company to bill the patient a different amount because the hospital was providing the exact same service, whether they were in or out of network. It was the same Band-Aid, the same IV, and he clearly saw that that was unfair, and from that effort actually got a law passed in the state of New Jersey.
That's very interesting. And I'm sure that most of the people who listen to this podcast are going to find themselves standing in the same position that you were standing then. And it's interesting to me that the senator was honest enough to tell you exactly what you had to do to be heard. And, I think we all are aware begrudgingly that politics is very often all about the money, if not always. But for the senator to have been as honest with you is sort of refreshing for me. I mean, we don't like to think that we can buy influence, but if that's the reality, and we don't live in that world, to be able to have someone be honest about it is quite a refreshing story, and I appreciate you sharing that with us.
I would just say that over the years, having been involved with that, I was involved in soliciting other physicians to participate with me in these ventures. And the real fact is that for you and I, we're very comfortable in a hospital. We're very comfortable in an operating room. That's what we understand, and that's what we do. And I think part of the problem of being a doctor is obviously you did well in high school, you did well in college, you did well in med school, you did well along the way. And unfortunately, what happens is people think that they have knowledge in areas where they really have no knowledge, like politics. And the truth of the matter is that when I tried to solicit funds, I remember asking a doctor who was an obstetrician, and I said, listen, we need to support this particular legislator because they share our interests, and we want to make sure that they're supported. People who support your interests, you need to support. Now, I didn't come up with this system. I think it is horrible. I think it is unconscionable how we look at campaign contributions. How much did you give? Who do you meet with? And unfortunately, once I was exposed to it, a little bit of it, it only escalated exponentially. There were meetings with legislators, governors. They have fundraisers, and these are substantial amounts of money And based on the amount of money that you would come up with would determine your access ultimately, although it wasn't billed that way, but that was clearly the facts. And it was a little discouraging to see that that's what happened. But I clearly realized that me sitting there and talking about what was right for the patient, it didn't matter because the people making the rules were the legislators. And I think the other point is that I was mentioning this obstetrician, and I said, we're raising money for the campaign of a legislator who understands the critical need of healthcare. And the response of the doctor was as follows. He said, I'm not giving a penny to that. That's disgusting. They should do it because it's the right reason. Why would I give? I'm not buying. That's a terrible thing. I would never give to any politician. And I said, well, that's interesting. I said, let me ask you a question. I said, you deliver a child and the patient keeps the money from the insurance company and they come back to you pregnant. What would you do? He goes, hey, I have a family to feed. I wouldn't treat that person again. They stole my money. I said, well, that's exactly how the politician sees it. They have a family to feed. They're trying to ensure their reelection. So the only difference, my friend, is that you took an oath to help people. He did not. You took that Hippocratic oath. So you clearly need to make sure that things are important and taken care of for your patients. And I found out extremely successfully that being involved in the legislative process, going to Congress, meeting with senators. I was at a congressional caucus regarding Medicare maybe 15, 20 years ago. I've been extremely involved. And the real truth of the matter, Randy, is that if you and I and physicians don't take a leadership role in communicating the future, then we're lost. And unfortunately, despite the extensive battles, and I spent a lot of time doing that, this is a tremendous, it's like trying to stop the wave with your finger, with your finger in the dike. It doesn't do enough. And really, the political issues, the PACs of the organizations, the AMA, looking at the North American Spine Society, our New Jersey Spine Society, raised funds to be able to meet and to be able to support candidates who understood these issues. And unfortunately, in the absence of that reality and that knowledge, we basically end up complaining to each other in the hospital lounge how bad things are. And unfortunately, that's our responsibility. And that's why I think physicians, there's just a interesting article written by the mayor of East Brunswick by the name of Brad Cohn, who's an OBGYN. And he wrote an article that's about to be published talking about why he feels that physicians are uniquely qualified to be legislators, because when you spend so much time with people, it's like any other field in the world. When you see an architect, a lawyer, an accountant, it's very compartmentalized. And when you have your relationship with a physician, an appropriate relationship, you understand all of the competing issues, and you're able to amass tremendous amounts of data to hopefully deal with that compassionately, honestly, and in a proactive fashion. And I think that's why you're seeing more and more physicians getting into politics to try and hopefully bring that education, knowledge, and experience into the world of law and what matters moving forward.
Yeah, it's a really excellent point, Stephen, and I appreciate you sharing that story with us. And it really underlines one of our greatest weaknesses as physicians, I think, and that is that we assume, just as you said, that because we are bound by our honor, bound by our oath to always do the right thing. Not everybody lives by those rules. And unless we accept that reality, it is unlikely that we will ever have any significant influence at all. It feels distasteful to us because of the way we live our lives, but it is a reality. And your story is a really excellent explanation of why that is the reality. And I appreciate you sharing that with us.
I would just say that when I would meet with these people, I would tell my wife, I need to go home and take a shower. But unfortunately, we don't see the world that way. We don't see anything of politics. We see only from our own vision of what's best for the patient. And at times that's great, but at times that's a tremendous detriment because we look at physicians. You weren't sitting in the back of the class at the bottom of the class. Most physicians did very well in school. Most physicians, if they wanted to be a lawyer, they could have done anything. They could have been in business, could have done anything they wanted. But they chose out of a calling this career. So I think it's a bit of lack of knowledge and maybe some arrogance of saying, hey, listen, I've made it. I did very well. I've had the top training. I'm doing God's work. And now I can figure everything else out. And the problem is physicians are universally bad business people. And in this particular area, without any knowledge of just saying, well, I'm going to do the right thing for the patient and I'm going to go and yell and scream about it and complain about it. The question is how do you make change? And really the only way to do that was to understand the battlefield. And unfortunately, the healthcare policy is a battlefield. And all you got to do is turn on the news, look at all of our people running for office, how they're going to fix healthcare. Is it universal? Is it Medicare for all? What happens to the patient at the end of that? What happens to the individual patients who I see every day who have this insurmountable battle in front of them to ensure their own care? And I think that in the absence of physician leadership and direction, the situation will continue to worsen. So I think it's critically important to be involved and critically important to find your voice and critically important to be trained to be able to make that voice count. And hopefully some physicians listening to this will look at a career in politics moving forward. And I would certainly at some point in their career applaud that activity.
Well, we certainly hope that would be the case. And you just really make an excellent point. We do put ourselves in a difficult position with our arrogance, and we should be honest about that. But I think it's a combination of arrogance and innocence. Feel arrogant because, as you say, we feel like we've amassed a special level of education and expertise that should be respected, but it's the innocence of not really understanding exactly how particularly politics works. And you've done a really nice job of telling that story and helping make it clear, I think. Stephen, what I'd like to do at this point is see if we can shift the focus onto an area that is perhaps a little more encouraging, and that is your interest in philanthropy, which was something that evolved. I don't think you began your medical career necessarily with the intent of becoming a philanthropist, but you did. And I want you to tell us how that evolution came about and a little bit about Humanologi Foundation.
Happy to. I would say that growing up, charity was very important in my home. My parents instilled with us that as a Jew, every Friday before we would light candles for our Sabbath, we would always put money in a charity box. And that was always something that was important to me. My father passed away I put myself through college and medical school. I required financial assistance and loans and worked diligently to make sure that I was able to make it through my education, and always felt strongly about the need to help others. I remember when my father had passed away, there was an obligation to say a prayer, and they would have a charity box and they'd walk around to get money. And I remember having to go to the bank to change dollars into, dimes, nickels, and pennies, so it wouldn't sound so bad, that be one coin going in. I remember always feeling very fortunate to the institutions where I trained for having provided me the opportunity and education, and felt it critically important to pay off those loans and to be philanthropic to those institutions. From a religious obligation, you're supposed to give 10% of what you make to charity. We've actually done that.
So it sounds like the philanthropic attitude was actually instilled for you by your family. Is that correct?
Yeah, I would say the earliest certainly came from there. And as things became financially more tenable and successful, got involved in a number of areas, and found that philanthropic giving to a wide variety of causes really provided almost an unparalleled type of joy and happiness, just short of spending time with my wife and kids and family, and the tremendous professional pride and joy that I get when patients do well from surgery. Probably right after that is philanthropy, and being able to help others for a common good. And, it was interesting. I've had a phenomenal career. I love my patients. There's not a week that goes by that I don't get thank you cards, cookies, donuts, gifts from my patients.
Isn't that the best?
Nothing better.
It's just wonderful.
You get a card. I had a patient make a piece of art for me. To me, that is more important than anything else in the world. And I guess at this stage of my career, that's far more important than any remuneration could ever be.
And I would imagine, and again, my apologies for interrupting, but I'm interested to get your take on this. I think as physicians, we have an opportunity to look inside the lives of other people who we might not otherwise have any contact with at all. And it gives us a much better understanding of just how privileged we are through no reason other than the fact that we were in the right place at the right time, and how rich our lives are, how blessed we are, because we get to deal with the difficulties that other people around us have to wrestle with. They have challenges that we would otherwise be unfamiliar with if we didn't have the opportunity to share their lives through our connection with their illness. Would you agree?
Yeah, no, I 100% agree. And I think for me, one of the things that's provided me the greatest joy in my profession is my relationship with my patients. I call my patients the night before surgery. They all answer the phone the same way. And I say, hey, it's Dr. Reich. And they're like, what's the matter? Nothing's the matter. I'm just calling to let you know we're all set for tomorrow. You don't have to worry about it. I once had a colonoscopy. That's the extent of my medical care. And I was nervous that my very dear friend, Dr. Crowd, who's my gastroenterologist, forgot about me or maybe didn't remember. And I remember feeling some angst of, oh my God, I hope he remembers that I'm going to be there. Maybe he forgot that I'm on the schedule. And I guess that's a little bit of my CDO. Are you familiar with that diagnosis?
I am not familiar, and I can't wait to hear it.
Yeah, that's OCD so bad I have to alphabetize it. So I have to make sure everything's right. And now when I call my patients, I usually say to them, look, last call at the bar for you tonight's at midnight. I say, usually we're done last call like 3, 4 in the morning. So when I see them the morning of surgery and they see me, it's always a smile. And the first question is, what time did you leave the bar? And everyone, all the nursing staff, all the doctors, and everyone's there. I go, well, what was the last call? Like 4:30 this morning? What time did we finish up? And everyone laughs, but the patient laughs. And no one wants to be there. And I think to your point, Randy, even more than the ability to be inside and to help, and these patients never want to be the patient. And they trust their entire life in our hands. And I take that responsibility very to heart. I believe very deep in my soul that, the good Lord's put gifts in everyone. And these are the ones that I've been given. And I try to utilize them to the best of my ability. And I think that further to your point, when you meet a patient, you understand not just their medical issue, their social issue, what's going on in their life, how it's affecting them, what are their concerns, what are their work concerns, what are their religious, societal. You have a unparalleled view right into their life, and people will immediately divulge the most personal and private matters in their life to you because you have dedicated yourself to them. And I think that making that relationship with the patient is the most important. And I think to get back to the philanthropy, I've had a phenomenal career. And, there are a lot of challenges these days. There's a lot of challenges with insurance companies. There's a lot of challenges with legislation. Look at doctors. They have the open payment program, right? So if you get a cup of coffee from a vendor and it's over $10, it has to be listed on a government site. The implication that you should know what your doctor's getting paid for, but it's never, hey, let's worry about what their research or academic funding is your doctor doing this to fatten their wallet? It's fascinating that I saw on this open payments site that there was an entry, and I refuse anything from any vendor. And there was an entry, and I said, it's fraudulent. I had to write to their legal team, and they said, yep, they'll take care of it. And they said, oh, we forgot to check a box. It's still not taken care of. We admit it's fraudulent. And I said, well, why did they put my name down? They go, well, they just put, a number of people down. I said, this is a reporting on a federal site. So does it really matter if there's a coffee? It really doesn't. It upset me personally that someone would believe, or my impression was that this site wasn't to make sure everyone understood their research or professional involvement or reward for their intellectual property for designing or engineering. This was really, in my estimation, a site to degrade the physician and to make it appear that the decisions being made were purely economically driven by some sort of backdoor approach to the pharmaceutical or device industry. And I found that extremely offensive.
And of course, those rules were put together by politicians who, as we've talked about earlier, are accustomed to being on the lookout for people who are buying influence, right?
Right. It was interesting. We talk now about this tremendous opioid crisis, which is a disaster. I mean, it is, so many people die. And I will tell you a brief story. I remember when I originally started in my practice, my partner at the time, the president of the American Academy of Orthopedic Surgeons, who I was totally in awe from, I'm a couple of months into practice, newly started. He says, Steve, I need to talk to you. I said, sure. What's going on? I go into his office. He goes, I got a complaint and I need you to read this. So there's a complaint from a patient I saw to the insurance company saying, I saw Dr. Reich. He saw me for 2 minutes, didn't examine me. Terrible doctor, very bad. I was devastated. I personally dictate the entire office note in front of the patient. I do not use a computer. I do not use an electronic health record. I never click a button during a visit. So I wrote to the patient, "Dear Mr. X, I've received notice that you were unhappy with my visit. I'm terribly upset. I'm devastated by that. I see you wrote that I was in the room for not even 5 minutes. Enclosed, you will find a 3-page, single-spaced narrative that I dictated in front of you. You indicated that it was your arms, your legs, your back. You had incontinence. You didn't have rectal control. I go, you'll remember when I told you that I needed to do a rectal exam and perianal sensation, you were like, is this necessary? Why are you doing this? And I told you that your symptoms needed me to check all of that. I said, here's your copy of your medical note. To say that it was 5 minutes didn't make sense, but I do recollect that when we got to the end of your visit and you were telling me you were in pain, and I told you that I didn't believe that narcotics was an appropriate treatment for you, I remember seeing something that you were a little unhappy, but you were going to go ahead with my plan. I feel badly that you wrote to the insurance company. Obviously, we don't have a good patient-physician relationship. I will provide you as required by law 90 days of care until you can find someone else. And I'm really sorry that you felt that my care was anything less than the very best that I could provide. I'm this fellowship-trained spine surgeon, published, researched, first fellowship-trained guy. And here I am in my new practice with a complaint to the president of the American Academy of Orthopedic Surgeons. So I sent the response, and within a week, I got a call from the president of the insurance company who had sent it to my partner and said, Dr. Reich, I owe you a tremendous apology. You know, when I got the complaint, I assumed you were just a bad guy, and I apologize. I saw your note. I read through that note. I saw what you did at your visit. I knew something was wrong. I took the liberty of pulling up the patient's records. He has 8 doctors who are providing him narcotics. You are the only person who said no. And I apologize to you personally for having a bad thought, but you're the real doctor.
That's a great story, and what a great testimony to the reality of how important a real medical record is, as opposed to the macros and click boxes that come along with the electronic medical record. And I really appreciate you sharing that story with us. That's very instructive.
You know, it was terribly devastating at the time, but even look, you know, recently with the opioid crisis, I remember in my training, they said, oh, we're introducing the 6th vital sign, pain. I'm like, what? And they're introducing that. And I'm like, I don't really care, only for the fact, not that I want patients to be in pain, please, that's not the case. But when people have, you know, radicular pain or nerve root pain, I don't believe in narcotics. I always tell people it's like an alarm. Would you ever cut the wires to your siren? You'd never do that. So the pain is protective. It'll prevent you from doing something bad. You won't be able to step on a tack no matter how hard you try because it's too much pain. But if you get boozed up, well, then you could certainly step on it. So, you know, when you sit there and you look in the chart and they're all worrying about the pain score, and, you know, recently, and I've been saying this for years, that didn't come about from the doctors. That didn't come about from the medical society. That came about from pharmaceutical industry lobbying the legislators because they produced long-acting drugs and said, oh my God, people are in pain. We need to do something about it. And that's exactly how pain became the 6th vital sign. It was pharmaceutical lobbying. And now, whose problem is it? It's the doctor's problem. So now there's, you have to take a class in narcotics. You have to take a class in end of life. You have to take a class in this training and that training. So what happens is the doctors are being led, not by doctors, not by people who share the same interests. They're being led by legislators who have an agenda, whatever that is. And what I started seeing was the joy. My greatest joy is seeing my patients and doing surgery. And then I started having a lot of these other issues going on where things were becoming more problematic, with whether the insurance company, institutions, how things are getting done. I go to do a case, I have to go on the phone and speak to somebody about it. And then they say it's not approved. I go, well, what training do you have? None. But we're telling you it's not approved. Now I got to get on the phone again. Then I have to speak to a peer reviewer. But then they'll put someone on who's not a spine surgeon. Then I have to get that person to hang up on me. And eventually I'll get to speak to someone. But the obstacles, roadblocks, challenges, frustrations are exponentially growing. Maybe a year or two ago said, you know what? I've had a great career. I've had a great life. I think maybe I just need to go off into the sunset. Maybe I need to think about retiring. The problem is that there's nothing else I do enough that I enjoy enough other than providing care. And a very dear friend who I've known for many decades, when he was initially involved in the hospital during my cases, we met just as friends. And I told him this story that it was like surfing. Not that I could surf, but I always watch people surf as I look out in the ocean, and they surf the wave. And when the wave gets small, they get off the surfboard, they go out again, and they surf another wave in. And I said to him, you know what? I don't think I'm getting off the board anymore. I'm just going to ride this wave in. And if I hit into the rocks on the bottom, that's just the way it is. And in very clear language, someone who'd known me for decades said, I don't get it. You're a leader, and you're just going to be told what you have to do? That's not you. He goes, do you even know who you are? I said, yeah, I think I know who I am. And that started a very long journey for me in finding about myself. So when I talk to all of my friends in the business world, everybody goes for coaching, career development. They do assessments. They find about their personality, what really drives them. Here I am, almost 30 years in practice. I never took an assessment. No one ever really asked me what was inside of me. I just assumed whatever was there was there. And then I spent a lot of time doing all of these examinations and really finding out about myself. Now, my wife and my daughters, Danielle, Jessica, and Allison, even my son-in-law, Zach, were able to say, well, we could have told you all this stuff that you're learning now, even though I didn't recognize it.
Now, when you're talking about finding out about yourself, you're talking about taking some of these self-assessment exams. Is that correct?
Absolutely. And, it was really eye-opening to me because a number of things that I thought that my reasoning, why things would work out, really wasn't correct. And I remember on one of the evaluations I did, he said, well, how do you think, it was sort of an entrepreneurial business acumen. I'm like, oh, I'm very good. I can retire. He goes, no, actually, you're really terrible. You're not good at that at all. I said, yeah, so why is it that I'm successful? He goes, oh, take a look over here. See, this is your fear of failure. You're in the 99th percentile. You don't care what it is. You will never fail because you will obsess until you get it right. And I look back in my life, I said, you know what? That's pretty accurate. So one of the things I learned is that behavior, and which has been a problem for me, but behavior really is a combination of your personality. That's sort of like what you're born with. That really doesn't change throughout your lifetime. You have a personality, that's you. Well, then it's your environment, and then what motivates you. And you put that all together, you come up with a behavior. Now, the truth is, I've been called to the principal's office not infrequently. I have a very black and white binary view of things that are right and wrong. And if someone walks into the operating room without a mask on, I'm supposed to kindly say, if you wouldn't mind, when you get a moment, if you could put on a mask, because, I'm operating on the spine, someone's getting infected and meningitis and die. So when you get a chance, if you wouldn't mind, could you put your mask on? And I can assure you that's not what I say. And then I get, complaints, and then I got to deal with all of that. And my thought is, wait a second, I took an oath to protect my patient. And what I said to the previous president of blessed memory, Harvey Holzberg, when I got called in, I said, look, I took an oath to protect my patient. I'm not here to make friends. And he responded, that's painfully obvious. And he was right. And look, there is a better way to communicate. But I will tell you that through years and watching surgery and looking even at the reward, if a surgeon quietly said, hey, could you get me this? That never happened. It was only the yeller and the screamer who ended up getting what they want. And now somehow the rules have changed, and it's a little hard to teach an older dog newer tricks. I never felt, here I am, I'm so well trained. Who needs to coach me? But what a mistake. So this particular fellow was involved in utilizing assessments initially for selecting residents for programs. And I remember Dr. Joe Zuckerman, who was the head of my residency program, who's still the chair at the Hospital for Joint Diseases, NYU, said no matter what we do, we always pick 2 duds a year. And no matter what question we ask, everybody can be nice at their interview. The question is, how do you really find out who's going to be good and who's not? And what Alan worked on was trying to understand the appropriate personalities of the attendings and the residents and aligning that. And I think if we go back to my story earlier of ophthalmology and the guy coming in the pool hall telling me I'm an orthopedic surgeon, he did that personality assessment pretty quickly, didn't he? And so the more I...
So you were more or less getting a second opinion in that pool room.
Oh, yeah. That was actually the first opinion, but it took a long time for someone to quantitate it and scientifically evaluate it. And now, so I spent a lot of time with that, and I became deeply concerned. I've seen outstanding physicians quit healthcare because they hate it. Not they hate the patient. They love the patient. But they can't deal with the nonsense and garbage of someone telling you, you got to see more patients, you need more points, the insurance company has an audit, Medicare's auditing you, this isn't right, you're getting sued. And a lot of people can't deal with the negative. I had one of my mentors, one of my chief residents when I was a resident, and he was the chairman of sports medicine at GW, a wonderful guy by the name of Ben Schaefer, who unfortunately hung himself in his home. And we've had residents kill themselves. We've had residents quit our program. I've seen the amount of depression, anxiety, drug addiction, alcohol, walking into the doctor's lounge, seeing people be frustrated rather than joyous in what they're able to accomplish. And I said, this is bad. And my friend said, you know what? Your whole life you've been a leader. You have to take responsibility. Either you can just walk away with your tail between your legs, or you can try and do something to help the next generation. And I found this so helpful, and my wife found it so helpful, and my family. We started a foundation called the Humanologi Foundation. That's humanology with an I instead of Y. So it starts with yourself. You have to understand yourself, your own personality, so you can better interact with others. There are times when I see that the physicians aren't empathetic with their patients. They don't communicate well with their patients, which leads to more depression, more detachment. The patient doesn't care about the doctor. And if they feel detached, the literature is showing now that the care they get, they're unlikely to follow the recommendations. So every day, I would say almost all of my patients in the upper 90s percentile will hug or kiss me upon entering the room. And now I've learned I have to say, is it all right if I give you a hug? But the vast majority of my patients, I make it an effort when I'm talking to someone, if for a religious reason, obviously not, but in general, I will always put my arm on that human connection. And there was a study years ago about spine surgeons and chiropractors and patient satisfaction. And one of the issues was when the chiropractor has their hand on you, there's a connection. And it's interesting when I go for a massage, as soon as the person comes in, they'll put their hand on you to let you know you're connected. It's not letting go on, off. It's always that connection. And that stimulates something internally. And for me, that connection with my patients became so important. So we started this Humanologi Foundation. And what we did was it was a three-pronged effort to really combat what I see in terms of suicide, depression, anxiety, burnout. They say 70% of doctors are burnt out. Asking my colleagues, how many of you would do it again? Very few of them say that. That's a catastrophe, because if we can't fix that, things are going to continue to get much worse. And I think there are a number of critical items when I looked at it and said, why is it that I still enjoy it, but a number of my colleagues much younger than me have quit, retired, and were very competent? And one of the things that I found most important was my satisfaction with my patients being involved in their lives and having the patients, whether it's the cards or the cookies or the artwork or the ornaments or whatever it is, that personal connection to me was extremely important. I knew the way I was going to be a doctor. My father died when I was in college, way before I was in medicine, and I knew exactly the type of doctor I was going to be. I didn't need a class to teach me. I knew I would always approach people in a very friendly, laughing, jovial way. I would always try and put people at ease, and I would never try and be in a circumstance where I would wear fancy clothing or fancy jewelry. That's not the reason I'm there. I'm there to provide care. And I came to wearing scrubs, and obviously I would never bring them into, to the OR, but I always wanted people to know that my only interest was them. So this foundation was really directed to providing tools and resources to physicians, and we just decided to start with the medical students.
This might be a good opportunity for me to quote you, or at least I think I'm quoting you. This is something that I took from the Humanologi Foundation website. It says that your goal is to refocus attention on the roles of empathy, humanism, and compassion in healthcare. I think that pretty well says where you're going.
Exactly. Those issues, I think, are the antidote for the depression, anxiety, burnout, suicide. So it's that real connection with the patient. And just as you were saying before, Randy, when you walk in with a computer, someone else took the history, it's pre-populated, you've got to be in and out of the room in a few minutes. I see so many wrong decisions, and it's heartbreaking. And that's not why I went into this career. I'm sure that's not why you went into this career, to answer to a computer or an administrator as to what it is you're doing. So we felt that, part of this critical assessment would be for these personality assessments for the medical students to ultimately provide them the resources and tools, because if you figure this out when you're 40 years into practice, that's going to be a hard thing to fix. If you understand it earlier on, it'll probably help you moving forward. And when I recently addressed the AMSA, the American Medical Student Association annual meeting, I had said that all I ever wanted to do was to be a doctor and worked so hard. And despite the fact that I've had tremendous success, that there were problems and, people often forget themselves. Doctors are so busy treating everyone else. And that's really a disservice. We need to be more reflective and to be able to show up as the best version of ourselves. And basically what happened was we decided that we would first coordinate institutional partnerships for medical students with the American Medical Student Association. So when I was at Einstein, I think it was $75 to join. I didn't have the $75. So our foundation has provided a free membership for all students at Einstein in their 4 years. Secondly, what it does is it provides a number of these evaluations and assessments, and then debriefs and counseling so people can take their challenges and turn them into strengths.
So this would be going to what, again, from the Humanologi Foundation website, you're recommending, you're attempting to obtain an evaluation of the emotional intelligence of the students?
Well, it's a combination of emotional, but it's also their personality and what areas they have strengths in and in what area are challenges. So let them understand at an early time what these challenges are, and then be able to provide them with educational material to assist them, whether vignettes or readings or watching movies or understanding and pre and post-test verification of their improvement. How do you give bad news? Where do people have their strengths and weaknesses? And those really, a lot of them come from their personality, which is at their core.
And you're really advocating doing these assessments, obtaining these personality inventories very early in the process, early on in medical school. Is that right?
Correct. So we're currently looking at that, in the second year, so second, third year, because this way, when you're learning in the beginning, we felt maybe there wasn't the direction toward the wards and toward that clinical experience, mostly more didactic and laboratory training. And, again, where do you put that in? We don't want to burden them. It's an adjustment to get into medical school. There's a lot of stress with that. And the goal is not to have this be stressful. The goal is to have this be a tool to help them. And we think that through a combination of the resources and tools, there's the hard stuff that you learn in medical school, but it's all of the other softer areas or the soft aspects, such as feeling fulfillment, communicating the right way. That's what's going to get you up in the morning. That's what's going to keep you from being anxious and depressed, understanding who you are and what's really driving you.
And how are the students receiving this attempt to evaluate their personalities?
Well, so far it's been extremely successful. We've had our initial work has been with the board of the American Medical Student Association. They've had debrief, counseling, and pretty much everyone's experience is fairly similar to mine. Wow, I really didn't know that. I had no idea that that's what made me who I am. And you can't get to where you want to be unless you know where you're starting. And we all have, everyone's like, well, this is the behavior you need to have. And it's like, well, why do I feel how come that's foreign? Because you have to know how you deal with conflict resolution. You have to understand what are your motivators in your life, what is important to you, what are your core values. And I found that, as all these students have, found that to be extremely important. And as I was mentioning before, every one of my friends, I have a friend who is the president of J&J AccuView. And I said, how often do you use assessments? He said, anybody who is above the lowest level manager, we invest in them these leadership training and skills, and we look at their assessments and we try and develop them and make them better. And I think we've, at least for me, I've identified a tremendous flaw in my professional development. And maybe had someone taken that interest in me, maybe I wouldn't have been in the principal's office as often as I was.
I think you really have uncovered a very important deficit in the way we attempt to prepare young physicians. Kudos to you for having the idea, and I'm also very encouraged to hear that the students are receiving it well also.
One of the other things we did was I see that when the students and the interns and the residents, where are these life-changing experiences for them? And one of the things that our foundation did is we've set up scholarships for students to go to a number of programs around the world. Currently now, I was just at a pre-med for students who are going into medicine from college at a internship program. And the problem is they can't come in the OR anymore because there's not enough training. So how do people get these experiences? And I think that the doctors don't get enough experience of what it means to really see the value in what they're doing until so much later in their life. So one of the programs we offered a scholarship to is called Save a Child's Heart. It's a program actually in Israel where there's no HIPAA, which is actually convenient. And what happens is that patients who have congenital cardiac anomalies that need major surgery, transposition, great vessels, etc., and need open heart surgery, there are many countries that don't have the adequate resources or physicians to be able to do that. So what they do is they take children from all over the world, whether it's Ethiopia or the Sudan, and they bring all of these children, and if they're young, they bring them with a parent. And they stay at this program called Save a Child's Heart, and they do all the preoperative assessment, testing. The students can go with them to the cardiac cath lab. They get to meet the children. They get to meet their families. And then they can come to the surgery. And these people, the patients and their families, live there for a couple of months after the surgery to make sure that they're cured and doing well postoperatively. And there's training of all these physicians around the world. And having been to this program, it was fascinating. So my youngest daughter, Allie, who is starting Barnard in the fall, was there and volunteered. And I show a picture of my daughter with a number of these children, the patients, and their families. And I can assure you, they do not speak a single word of the same language. But I submit in the picture that they are communicating perfectly. You can see their eyes. You can see that smile. You can see their heart. And that kind of experience, to me, that's what will get our young physicians through. That will enable them to focus on what the goal is. The goal is not how quickly you can type into a computer. The goal is to make that human connection. There's a number of programs that we've identified, and we have these medical students apply for a scholarship, which covers their travel and their cost of attending the program. And they can go there and see firsthand what it really means to save someone's life, what it really means to connect with a patient, with their family, what true empathy is. Not what you think it might be when you become the physician in charge, but you get to see it and take an active role in that. So we think that between providing the membership for all these tools and resources for a medical school, between providing these assessments and then providing these scholarship opportunities for the students, we think, and our hope is that we will be able to provide meaning and value to what they're doing, to be able to combat some of the depression, anxiety, disappointment, and really to serve as a keel on that sailboat for when the waters get rough. And the fact is, they always will. It always will be problems, and there'll always be challenges. But you got to be able to have your eye on the goal. You got to be able to understand where you start, and you got to be able to have that vision of where you're aiming to, no matter how stormy the sea gets. And our hope and prayer is that it will be successful. And upon our successful deployment, we're looking to other physicians, alumni of their institutions, who would be able to say, you know what, this is something we can buy into and partner with. This is something beyond bricks and mortar. This is something that hopefully will provide long-term health to the healthcare providers and really give them the tools and resources to combat a trend which is certainly concerning.
Stephen, this is a really refreshing new look at physician development, and I can't think of enough words to say how grateful I am to hear that somebody is making an effort to do exactly this. I'm absolutely certain that it's going to have a profound influence on everybody that's touched by this process. Again, you're to be congratulated for to start the ball rolling. I realize that you're just in one spot right now, but I just can't help but believe this is really going to catch on. And hopefully, in the not too far distant future, everybody will be doing physician education, if not exactly in this way, in a very similar way. Well, Stephen, this has been really very enjoyable. What I'd like to do at this point is move along to what is actually my favorite part of the podcast. You have clearly had a very successful and, I should think, a personally rewarding career. And we'd like to hear your thoughts on what made that happen. So if you will, please go ahead and give us your personal prescription for success.
Randy, I want to thank you so much for making the time to speak with me today. And I hope that some of this experience for someone along the way will be helpful. You know, you asked me what the prescription for success was. And I think it's really the prescription for success and contentment. And I think I have just a few basic rules. And I think if you treat every single patient like they're your family, you'll do the right thing. Treat everyone like your mother, your father, your sister, your brother. If you treat everyone like your family, you'll never have to worry that you're treating anyone the wrong way. And as I mentioned before, I saw how my father was treated when I was in college. He died from colon cancer. And I knew exactly the way I would communicate with my patients that day. And I think that experience of being real and treating everyone like they're your family member is probably the most important. The second thing is sort of related, which is make a personal connection with every patient. No patient ever wants to go see the doctor. I personally find that humor, laughter, joking around, giving a hug, being relatable is the most important. Because if I can convince my patients beforehand that I'm truly concerned, as I am in their outcome, I believe that every patient, not only will they have a good outcome, but I believe in some way they feel that they're disappointing me if they're not doing as well as I told them they should. So it was a little sort of pretest bias in treatment. So that personal connection is important. One of the other things I tell all of my residents is to pretend that every patient who comes and sees you is wearing a 20/20 camera, like the TV show when they come up your driveway and they did an undercover. So I tell them, pretend everything you say, everything you do, every patient interaction, how you scrubbed, what you did in the room, how you were in the case, and they're going to show that video. And at the front of the room are all of your mentors, everybody who was important in your training, all the people you looked up to. And they're going to show the video, and you're going to be watching the faces of all of your mentors. Are they going to be sitting there, putting their head in their hands, shaking their head no? Or are they going to look up with a sense of pride that they've really created the next generation? And I think having that 20/20 camera on every patient and feeling that is critically important. I think, as we spoke about the real key is to remember why you went into medicine in the first place. You did that, or I did that, and we all did that, to be selfless, to help other people, to provide care. It's important to get meaningful experiences that will really serve as the keel for the rest of your journey when the waters get rough. And they will. But you need to have that basis of remembering why you did it and what the goal is in terms of the kind of relationship and what you're going to be able to provide for those patients. And I can honestly say that for me, I never spent any time until the past year or two in terms of preparing myself with all of this frustration and angst, what I could have done to have made my life different. My poor wife and children have had to bear the brunt of the difficult personalities, the work that I took home with me, the difficulty to separate myself from the care, the many parties and celebrations and family events I had to miss while providing care to others. And at that time, I really wasn't providing enough care to myself and to my wife and my children. I think it is critically important to be able to understand what makes you tick, understand who you are, understand your own personality. Just as we spoke about the evaluation, having a coach. Every athlete has a coach. Every business manager has a coach. You have the most sacred profession in the world, and we fall flat on our face. There's no one guiding. There's no one helping to make that better. Well, it's not true. No one, just too few and too infrequent. And that's why what you're doing, Randy, and what we're trying to do at the Humanologi Foundation is to provide these evaluation, coaching, teaching, mentoring, to be able to take those challenges, which every person has, but identify those areas, work on them, and recognize your strengths and put your effort on your challenges. And I think the last thing is always is you've chosen a career by definition to help others, to be selfless, to be philanthropic. And whether you do with your time, your resources, and passion, all of it together will help to create a better world of medicine, hopefully moving forward to the next generation. And I think that if I could go back, those are a number of the things that have helped me tremendously through my career and the things that I would have changed. And I, again, thank you for spending the time with me. And hopefully this has been helpful for those listening to this podcast.
We have really enjoyed hearing about your journey, and we appreciate you sharing the bits of wisdom that you have accumulated over your more than 3 decades in practice. It's been very enlightening, and we were honored to have you here today. Before we go, I want to make sure that you have an opportunity to let our listeners know how you can be followed, websites, email addresses, any connections that you would like to make. Would you please go ahead and tell us right now?
Sure. So our website is Humanologi, that's Humanologi with an I.org. And my email is Stephen R., like my last name, Reich, Stephen R. at humanologi.org. And I'd welcome any interest and questions. And if I can be a source of encouragement or provide any mentoring, I'd be more than happy to do so. And I thank you for having me.
Well, you're very generous to make yourself available, and I will take the opportunity to make sure that everyone knows that Stephen is spelled with a V and not a PH, so that we get your email address correct. And once again, thank you so much for being here, and good luck with Humanologi Foundation and all your other endeavors.
Thank you very much, and I look forward to following up with you soon.
And that brings to a close another episode of Prescription for Success. You can review the show notes and gather a little more background information about my guest at our podcast website, rxforsuccesspodcast.com. That's rxforsuccesspodcast.com. And while you're there, please subscribe. If you're enjoying the program, please help others find us too by leaving a rating and a review on your favorite podcast distribution platform. We really appreciate your support very much. Thank you so much for listening, and don't forget to fill your prescription for success with my next episode.